How do neurovascular and genetic factors interact in migraine development? Imagine your brain as a busy city with roads, traffic signals, and power lines all working together. Sometimes this system gets overwhelmed, leading to a headache that feels like a storm. That's what happens during a migraine. But what causes this storm? It turns out two main players are involved: neurovascular factors and genetics. They work together in ways that can make some people more prone to migraines than others. Neurovascular factors involve how the nerves and blood vessels in your brain communicate. When neurons become more excitable, they send signals too easily, kind of like a car alarm that goes off at the slightest touch. This increased activity can cause blood vessels to widen or narrow unexpectedly. These changes can trigger pain signals and lead to the throbbing pain many migraine sufferers experience. Genetic factors are like the blueprint you inherit from your family. Certain genes influence how your brain's nerve cells and blood vessels behave. Some genes affect ion channels, which are tiny gateways in nerve cells that control electrical signals. If these channels don't work properly because of genetic mutations, nerves can become overly sensitive or fire too easily. This abnormal firing can set off a migraine. Many common migraines are caused by a mix of multiple gene variations. These variations don't cause migraines alone but make your brain more sensitive to triggers like stress, hormonal shifts, or certain foods. Think of it as having a fragile glass that's more likely to break when bumped. This genetic makeup influences how your nerves and blood vessels respond during a migraine attack. In rare cases, like familial hemiplegic migraine, specific gene mutations directly cause the disorder. These mutations affect ion channels that regulate calcium, sodium, and potassium flow in nerve cells. When these channels don't work right, they cause abnormal nerve activity and blood vessel responses. This can lead to symptoms like aura or even temporary weakness during attacks. Epigenetics adds another layer to this story. It's like a dimmer switch that adjusts gene activity based on environmental factors. Stress, lack of sleep, or hormonal changes can turn certain genes on or off, further influencing how nerves and blood vessels react. This makes migraines even more complex because it's not just about your genes but how your environment affects them. Understanding how these two factors interact helps doctors develop better treatments. Some medications aim to stabilize nerve activity by targeting ion channels. Others focus on improving blood vessel function to reduce the severity of attacks. Knowing your genetic makeup can also help predict how likely you are to develop migraines and what triggers might be most problematic for you. So, in simple terms, migraines happen because your genes set the stage for heightened nerve and blood vessel sensitivity. When combined with neurovascular responses to triggers, this creates a perfect storm that leads to a migraine. It's a complex dance between inherited traits and how your brain and blood vessels respond to the world around you.